Thank you. I want to thank everyone for joining us. This is June the 25th, 2020. This is a Henderson County Board of Education special meeting, and I'd like to call this meeting to order. The first item on our agenda is to approve the minutes from the prior meeting. That is a regular meeting on June 15th and a special meeting also on June 15th. Are there any additions or changes to either one of those meetings? Hearing none.
Madam Chair, I'll make a motion we accept the minutes as presented.
Thank you, Mr. Mike. Do I hear a second?
Second.
Thank you, Mr. West. All in favor say aye.
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 Any opposed? Motion carried, minutes approved. Moving on to the student calendar. Ms. Casey?
Good evening, Board. So last week, I shared with everyone the proposed 2021 calendar. This was an amended version of the calendar. We originally approved our calendar in November and December of 2019. I believe everyone has had an opportunity to look at it. I did have a few questions, and I submitted answers to those questions. Does anyone have any additional questions in regards to the calendar? No? No. Okay.
I think I understand.
Okay.
So all we did was change, all we're looking at tonight is changing the student's first instructional day, and we moved back one day. Is that right?
That is the only thing we changed from the original calendar was the start date, which we have moved from August the 12th to August the 26th, and the end date.
Okay. Thank you.
Only those two.
Okay. Any other questions for Casey? Hearing none, I look for a motion to approve the student calendar as presented.
I'll make a motion we accept the student calendar that's been presented, the amended calendar.
Thank you, Mr. Mike. Do I hear a second? I'll second that. All in favor say aye.
Aye.
Any opposed? Motion carried. Thank you, Ms. Casey. Moving on to the virtual learning option. Also, Ms. Casey.
I am very excited to talk to you guys about this tonight because this has been one of my soapbox issues for many years now. So you see in front of you a updated, we've had an alternative education policy in the district for years. There are just a few updates we would like to make in this policy. First off, the previous policy was only for grades 6 through 12. We would like a change to be able to utilize this possibly for grades kindergarten through 12th grade. Also, in our previous policy, it was strictly punitive, involuntary type placements, and we see that there are reasons to use alternative types of education now that are not punitive, that are voluntary and by choice, and that they can be very helpful and aid students in being successful at school. Also, another major change was in the previous policy, it specifically stated that it was only on-site at Central Academy where alternative education would take place. In this proposed policy change, we changed that to on or off-site, meaning something could just be 100% online. And then I believe those were the three main things that we wanted to see addressed in a revised policy.
We ask questions.
Sure. Go ahead.
Just describe to me how you see that working.
Well, I think that I just feel like, for example, in the past, we have had Central Academy e-learning. That was a program established a few years ago, and that is where many of our students that have attended whenever they are put up for expulsion before the board or something such as that. As we've progressed over the past 2 years, I've had parents come to me and ask to have their child placed in that program because one student specifically, her grandfather has begged for her to be placed in this program. She is not a behavior problem. This would not be punitive for her, but she has serious anxiety issues. She sees doctors, she has a therapist. She works really hard to lead, just daily life is difficult for her. Henderson County High School, as great as it is not what's best for her. She's smart. She's a really smart kid. So I would like to see students such as her be able to use an e-learning program such as that. She's a great student. She never causes a problem. So it's not really a punitive issue. It's more of a voluntary wanting to participate in a fully online program.
Okay, so then is this student, as you're using as an example, she could do it from her living room, kitchen,
Yes.
her workroom? I mean, it wouldn't have to be on a school
anywhere.
facility site. It could be done from anywhere as long as she has the hardware,
Correct,
To-
as long as she has a Chromebook or a laptop.
hook up, work at her pace, or would it be a pace with a teacher, guidance, or how would that be working?
In that program, we have a teacher that is assigned to the students, and they pace the program out for the students. They make assignments, they grade the assessments, grade the writing tasks such as that. So those students, they have a teacher assigned to them that helps to pace them throughout the school year and is there if they need assistance.
And access to that teacher anytime while they're working or at specific times that are designated?
Currently, with that program, we have specific designated times. I think they're Monday through Thursday, maybe 3 o'clock to 6 o'clock, something like that.
That's how we're going to see this set up if we approve this?
Well, this is kind of separate. I have another piece that doesn't have to be tied to this policy. I would like to see a virtual learning academy be created, and I've started developing that. And that would be something that we could offer some of our parents in the district, totally separate from this, that if their child were to choose this school year that it's not best for them to attend in-person classes, that would be an option for those students. It doesn't necessarily have to be a piece of this policy, alternative education. It can be separate.
But we would need this policy change to be able to incorporate that.
Right, to
Yes.
include kindergarten through 12th grade students.
Because we changed the grade.
Right, so the
Yes.
policy is kind of the big umbrella, which allows us then to offer virtual opportunities for our kids, our students in a variety of ways.
And this
Yes.
changes it from punitive to positive.
Got it?
It can be voluntary or currently
Involuntary.
it's involuntary. We want it to be able to be involuntary or voluntary.
And as Ms. Farmer Wolf just mentioned, it would be a great opportunity for our parents right now during the pandemic that feel it is the best option for their student or their child to be at home learning online. And as she mentioned, that she's already started to put some procedures together of what that could look like, that we would be able to provide the family with a Chromebook, and we would assign teachers to 15 to 18 students, and that would be that teacher's job, would be to manage and help keep the kids that are learning virtually at home on track. We just see that.
So-
Go ahead, I'm
Pardon me.
sorry.
So when and if we ever get to the point on determining how we're going to open the schools back, is this a portion that could be available
Yes,
by August
absolutely.
26th?
Yes, it will be, could definitely be ready before August 26th.
Thank you.
Any other questions?
I just have a comment.
Okay.
In the situation with the young lady that you were talking about, do those students, before this policy, if we change it, they did the homeschooling, not homeschooling, no,
Home
Yes.
hospital.
Home hospital.
Yes.
home
Some of
hospital. That's what I was trying to think of. So,
them, we lost to homeschool.
Okay.
Many of them, we lose to homeschool.
okay,
Or home hospital.
home hospital is what I was thinking. So, because they literally see a doctor and a therapist, and
Yes.
and they establish that doing home hospital would be better. So this piece would allow them to do the e-learning and not have to be on the home hospital thing.
Correct, because some of them, they don't really need all of those home hospital services, but in the past, it's the only way to get that curriculum online for them to meet their needs.
And just to share with the board that the policy changes in here, if you go to the section where it starts to talk about voluntary assignment, it's written in this policy just for the 2021 school year. So we're asking the board to consider it for this coming school year. Then based on the success and kind of as a pilot with it, then I'm sure it would probably be recommended to continue. I think we have the resources and the funds to be able to do that. But for right now, the recommendation's just for this 1 year, and then let's reevaluate.
Kirk?
Okay. I may have misread this, so. So on page 2, where it says voluntary assignment 2020-2021 school year option,
Uh-huh.
the current policy is in black letters. It says a student's parent, legal guardian, or a student who is 18 request the voluntary assignment. So bullet point number 1, is that what we're using as our determination if a parent says, I want my elementary school student has health issues, or we have health issues at home, or we are making the choice that we would like our student to be a Henderson County student. We're going to provide the student with a Henderson County Chromebook and charger, and then that's the bullet point that we're going to use, and we're still going to count them in Infinite Campus for our membership and attendance.
Okay, so yes, bullet number 1 would, the first
Okay.
bullet would be the way that falls underneath that. Now, currently, as of today, the way, yes, they're enrolled in Henderson County schools, they're in an Infinite Campus. Currently, as of today, if this student enrolls in this program and is virtual, then there's not a daily attendance, there's not actually an attendance component. There's just the completion component. So once the student completed the entire course with a passing grade, then we would receive full funding for that course.
Okay, for the course.
For the course. But KDE is currently looking at ways to address that for the 2021 school year that might allow us to use them in daily attendance and count students in at-home attendance and daily attendance equally. So we are hoping, and I've emailed Rhonda Devine so many times at this point, she probably just wants to delete my emails. But they keep telling me it's coming, it's coming. They just haven't rolled that new system out because the way the system's currently set up is not to count students that are not physically in the brick and mortar school. So we do expect to see some changes that I think will greatly benefit us in the next month or so.
And then just to clarify, we're saying that if Mr. Haynes is the first grade teacher and students are physically coming to school, Mr. Haynes doesn't have an additional 15 students virtually. It's going to be a completely different teacher of record.
That is correct, yes.
And the grade will come on a Henderson County Schools report card.
Yes.
Okay.
Yes.
I think this is a wonderful program. I'm sorry it took this pandemic to get us to this point. But if it works out, this will be a benefit to a lot of students in Henderson County, and they will get a quality education from us, not from virtual places that we don't know about. So I think that's great. So I will keep my fingers crossed that all the T's get crossed and the I's get dotted. Yes, sir.
I have
One more.
two more questions.
Okay.
So we
Sorry,
pay
go
a fee for the policy service of the Kentucky School Board Association. Did our policy advisor review this before it was presented to us? Okay. And then are we saying that if a student starts day one, August 26th, which we just voted on, then they're going to be virtual for a semester, for a grading period, for a school year? How long can that family choose to be virtual or come back into brick and mortar? Let's just say there's a vaccine on January 1st and there's 5 kabillion vaccinations available and everybody on the whole planet can get one. Okay, so extreme case.
So, currently, this is another one of those things they're working on. Currently, a student, in order for us to get funding for that student, the student must stay on that course load, complete that entire course. Now, it's okay if they come in September, as long as they come in September and they complete the course by the end of the year, we get funding for them. But if a student chooses, let's say they start in August, and let's say in October after fall break, they're like, we want to go back to school. Then at that point, currently, we would not receive funding from August through October for what they did. But they could return to a brick and mortar school, and we would receive, if they come on a daily attendance basis, we would receive a funding for them from October to May.
Okay.
The change that they're discussing is that instead of having that be the case, as it has been in the past, that is something that they're also looking at maybe semesters instead of full years. And that was actually one of the things mentioned yesterday in the governor's press conference. So we expect to get more information on that very soon.
Okay. And we're making it very clear to the families, especially like elementary school, that if they choose the alternative education program, the student is not eligible for extracurricular activities. No sports, no band, no academic team, yada yada, technology, STLP, any of those activities. Is that right?
Yes.
Okay.
Typically, thus far, when a family comes, say if they're going to go to our alternative school to a program like that, or if they meet with Miss Thompson at Central Academy, we review this in full before those decisions are made. So.
And I'd like to make a little addition there, because things change daily that we
Yes.
get from KDE and the guidance. And that is being reviewed, because at the Kentucky Department of Education, we learned right yesterday before the governor spoke that they might be trying to put together a Kentucky virtual program, because there's a lot of districts that aren't in the position that we are in Henderson to be able to offer this to students. We're able to do it because we have a similar policy in place, because we have one-to-one Chromebook K through 12th grade, because the Board of Education has spent money on software packages, and we have a lot of forward thinking from the DPP department, Ms. Casey Farmer. So we're in a good position to do that, but not all districts are. And so when we heard that they were looking for something, then some of our guidelines, we're not sure if we'll have to change those or not. So, and that was one of the pieces that was talked about. Well, if you're on virtual, Kentucky virtual from the state of Kentucky, can you go in and still participate and go to dances and things like that? So I just want to make sure we're being as transparent as we can before you all make a decision on to whether to approve this or not, that there is a little bit of discussion there.
Considering where we're at now, does that have to be part of the policy, that a student is not?
No, we would
Eligible
put
to
that in our
participate?
procedure.
Those would be in
We would put that in the procedure, so we feel good about passing the policy still this evening. And then there's a whole procedure handbook that we already use at Central for the involuntary students, and we would make those changes in our procedures, which we would certainly bring to you all for to review. Yes, so
So that we
policy, I
could
think
change
we're
the
okay.
procedure that allows anybody that voluntary could participate in the extracurricular activities.
Yes.
Yes,
Thank you.
we can designate that in there.
Yep.
I wanted to make sure. So, Mike, you're saying like if it's a child just for this school year because of COVID reasons or whatever, that you want them to participate? Yes. I do too.
Yeah.
And so could we make that
Or be able
change?
to, and
Or be
that-
able to if
if that requires a change from us.
as long
or
as it's a voluntary
some-
placement.
Yes.
Can we make that change? Before we have to read it twice, right? So it's read tonight and it has to be read one more time.
So we could,
Yes.
right. So we can approve it with
Right.
the changes this evening, and then if we have to change one word in it to make it voluntary, then with the second reading, that would make it official. Correct, Casey? Is that
Well, we
correct?
can approve the policy first reading tonight.
first
And then
reading
approve the
tonight,
policy
yes.
second reading for the virtual.
Yes.
And they can change the procedures with just one
Yes, the
okay
procedures
by
can
us
be
once the
changed.
procedure change is made.
That's just the
that
procedure part.
voluntarily virtual can go and participate. Is that way I'm understanding it?
That part of it is going to be the procedure part. I don't think that's
That's not
part
that
of
the policy.
Thank you.
Procedure has to
I
follow
knew you
the
were wanting to
policy.
say yes.
But does it say in there? Okay,
the virtual process and the voluntary process and all that tonight and with a second reading.
But doesn't the second, Beth, does the second, it has to be read twice, but it can't have changes in the second reading.
Do extracurricular? Wouldn't it be dependent on why they're doing virtual? I mean, if they don't want to be around public. Okay.
Okay, but what I'm saying is right now it says students assigned to AEP shall not. Okay, but when it's read the second time, that language could be cleared up and we'd be okay.
Yes, as long as you're acknowledging it tonight, it's
Okay.
official and that's gonna be there.
yes.
And
Your first reading includes that.
Wes, what's your question? Wes?
So, should we make it dependent on why the reason is that they're going to e-learning versus just giving a blanket statement saying everybody can do extracurricular? I mean, if the whole purpose of them doing virtual is to stay away from other kids and, for COVID, you want that same kid to, I mean, I don't think they're going to voluntarily participate in sports or band or something like that.
So I can share with you the scenario that was shared yesterday to think about this as this was being discussed. You could have a student who is has their caregiver. They've been at home. They have self-isolated because the caregiver is in the high-risk category, and so they really don't want their student to interact with a lot of folks. However, they're on the golf team. And the golf team is a sport that can social distance probably better than any other sport. That was the scenario that was shared that kind of paused. Maybe it shouldn't be so blanket, and then the folks at Kentucky Department of Education that were developing or brainstorming, could we make a Kentucky virtual program, said they needed to take that into consideration and get legal advice as to how that could happen. So when we heard that yesterday, we knew that that could affect us here locally also. If it's involuntary, no, we're good. But if it's voluntary, it made us pause to say, we better watch what Kentucky virtual learning may end up looking like and what their legal advises.
Because one of the things that comes into play when you start picking and choosing is that discretionary function that, and so then you have a parent that's really pushing for, I want to stay at home, but I'm comfortable with the distancing in volleyball as opposed to basketball. I mean, like it gets to be who makes that call. So that's where the kind of legal gymnastics part of it really has to be looked at as to, are you going to do it all or nothing or somewhere in between?
I think they'll clean that up for us and help us with that. Very different than what we thought 3 days ago.
So am I hearing from the board that we want to approve this policy change as it's listed this evening, with the caveat that there may be a few words changed because of the constant changing that's happening? And then we can address that at the second reading?
If you adopt it
If
as
we adopt-
written tonight, it
Yes.
allows you to implement the program.
The programs, right?
And
Allows Casey to
the
start
sports
working on it.
component can happen later. You can revise just that
That's,
section
that session.
at a later time when we have a little more understanding of how that's going to
Right.
interplay
Some
with a
different information.
statewide program versus
Right.
a local program. But I mean, you want to go ahead and do the first reading tonight so we can get that in place and then deal with the other part separate, because that's
Because if we,
that's not
if we
a
don't change some of
mandatory
this,
providing.
Casey can't move forward with
Right.
the programs that we're talking
Right.
about to get them in place.
And you have a
And we don't
right
wanna
to
stop that.
education and not
Because we want we want you to
extracurriculars.
have as much, get it going before the 26th. And if we need to tweak this again, we can tweak it again. We can do another first reading and second reading if we need to, all over again. But we need to get this going in place tonight so Casey has the approvals to get her program going, correct?
Yes, and I just wanted to say thank you for using KSBA. That's a good investment on our, I'm glad we're members, and I'm glad that we subscribe to the policy service. So thank you for doing that. Thank you for your hard work.
Okay. Any other questions before I ask for, yes, Wes?
I was just going to make the motion that we accept it.
You're a good man. I like you. Do I hear a second? Thank you, Ms. Tracy. All in favor say aye.
Aye.
Any opposed? Motion carried. Thank you, Casey. Thank you for all your good work. Moving on to childcare.
I'll do a
Are
little
you
bit of.
able to hear me? Can you hear me? Okay, just making sure.
I can hear you. I can't see you, but we can hear you. Go ahead.
Good evening. Thank you all for letting me come back this week. At your last meeting on June 15th, I shared with you a PowerPoint proposal for reopening childcare as of July 13th. You all submitted some questions to those, and I've responded to those. So I was checking to see if you had any other questions for me at this time, please.
Tracy? No? Mike? Nope.
I don't have any questions, thank you.
Kirk?
Oh, looks really good, Kim.
What about you, Wes? Good to go? Okay. All right, Miss Kim, you did a great job. Yes, let's do this. So I need a motion to approve the Henderson County reopening childcare proposal as listed. Thank you, Ms. Tracy. I'll second that. All in favor say aye.
Aye.
Any opposed? Motion carried. And so, Ms. Kim, to be exact, that would be a child care service is going to be opened on July 13th. Is that correct?
Yes, ma'am.
Cool. Just trying to make it straight for our public who are out there listening.
Thank you very much. I will communicate to our directors, and they will get everything going to get families registered. We appreciate it.
Thank you, Ms. Kimberly. See ya. Moving on to athletics, Steve Steiner and Mark Andrews. And Mark is joining us virtually, and Mr. Steve is right in front of us.
Got it. So let me go ahead and start, and I think Ms. Robin has sent you the basics that we'll be going over, and there's a couple of things in there that's additional based on your comments and questions and thoughts from last time. The first one I'll start with is the guidelines and the district basics. We did adjust a couple of things on there, and I'll kind of point out some of those things that we adjusted, and I'm sure you guys probably noticed that. The first on district expectations, we did put at the beginning, coaches and directors, COVID training, and Mark and Vivian and Tommy have looked things up and figured out what they could use for COVID training and have that put together. As you kind of scan on down, the limits of group size, the first bullet has no gathering of more than 10 athletes to one coach at a time, inside or outside, prior to June 29th. Obviously, that's where we started. And in our conversations since the last board meeting, the high school and Mr. Andrews and Ms. Vivian also think it's probably good to continue that practice if allowed, to start with a 10 or fewer, rather than what's allowed currently, which is the up to 50 students with a coach. So they would suggest that we continue with that 10 athletes to a coach at one time. Another addition is under screening. The first bullet there would be COVID testing required, and I just put a couple of question marks on that because those are the questions that we need to answer as we move on. So prior to beginning practice, they would need COVID test, or prior to returning, obviously prior to returning with screening problems, would they need that? So I think Mr. Horton is here to kind of help with some of those questions as well. Family expectations we placed in there, which is a different part of this. And family expectations, we kind of looked at different groups around us and said, what are they doing? What are they not doing? And we listed those things that we felt are important. Obviously asking the parents to do if we continue or if we start our athletics back, these are the things that we would ask families and expect families to do. We did list an athlete expectation as well, and those are listed pretty straightforward things that we're going to request and ask. The weight room expectations stay the same. Those are pretty intense and pretty specific, so those pretty much stayed the same. On that last page is just kind of blanks at this point to tell us if we adjust from June 29th forward, what would be the expectations that we have. That's the only thing we adjusted on the guidelines and the district basics. Would like to take a second or two to kind of further you along on some other things that we've been working through that also relate to what will happen with our athletes if allowed to participate. We start with the work-related. You have that one, Robin? Yeah. There's a grid that you have the grid there, the work reporting expectations. HR, Human Resources, Adrian, really, Ginger and their team really worked hard to get this to a level that's almost self-explanatory. So I know that you've had the board packet, you've been able to look at that, but the biggest part of that is on the left-hand side. The employee status is the top left box, and you can see all the way across there's several different statuses that you could come into. Right below that is work restrictions. What will happen if you are that top box, and what takes place, and then how you return to work based on that top box goes all the way down. So those are fairly self-explanatory, and I think you've had time to kind of look at that. But this is what we use each and every day coming into work now at the central office. And so this is our document that we follow. The next page that you can see that will show up there is Chad and I worked along with HR and some others to adjust work-related expectations to what would it look like for athlete expectations. And so you can see there the adjustment maybe on a few words here and there, but typically the response is the same, but we just try to gear it towards athletics versus work reporting. It has some examples, close contact. Someone's been within 6 feet of an affected person for at least 30 minutes. That's been a consistent definition that we've used and that we go by for close contact and what that means. So 30 minutes within the 6 feet, starting from 48 hours before the illness onset. Having direct contact with an infectious secretions of a COVID-19 patient being coughed on is an example there. The self-monitor is defined at the bottom there as well, just like it was on our work one. taking the temperature twice a day to remain alert for symptoms and notifying your person if symptoms arise. Okay. Couple of things on each of those has a yellow thing at the bottom, a little yellow highlighted spot for the workplace. It's maintain 6 feet between you and other employees at all times unless ... And so a reminder for the athletic one was maintain 6 feet between you and other participants at all times wearing personal protection equipment when not actively participating in athletic training. So just to show you, those are the expectations. And the reason why that was important to us is because each person can have a different definition of, well, what does this mean or what does that mean? And when you're a coach out in the field trying to figure out the answer, you shouldn't have to try to figure it out. You should be able to just pull up something and go, this is the answer. And so we tried to streamline that and make it as easily followed as possible. The next page you'll see is a reporting to work procedure. And this is just further information about how things are happening. And it's this reporting to work procedure is modeled in our athletic plans as well. So you can see it's just a little simple, straightforward. You enter, your temperature's checked. If you go over here, you're green. If you go over there, you're red. And then you followed along, and that tells you what to do. So just another, to be honest, these things look pretty simple, but it is not a simple process to get it to this spot. I can guarantee you many hours and days were spent on that, and it's embarrassing to say, but to make things simple, you have to spend a lot of time on it. And so
And
we
Mr.
tried to...
Steiner,
Yes,
do
ma'am.
I understand that some of these are some of the same similar procedures that are being used by corporations here in our community and
Yes, ma'am.
across the state?
Yes, ma'am. Ms. Stanley took the time to ask different groups, and she can name those off if you feel comfortable naming those off. But
We're
what
not-
they used, and then we begged, borrowed, stole, and tweaked to make ours
To make it
for
work.
there. So
Yeah.
you need to speak to those you borrowed from, or you good?
Oh, it's okay.
Okay.
Yeah.
Okay. Oh, sorry.
I just want to know our community know that we didn't invent this wheel.
No, ma'am.
We're working with other people in our community and other people in our state to try to come up with the best plan. So this is
No
this is
doubt.
a best procedure plan that's being used other places, not just here in Henderson County Schools.
We're borrowing.
Yes, ma'am. And I appreciate that. Go on, Mr. Steve.
Yes, ma'am. This is our last document for this piece of the talk tonight is the pass-fail. And it's, once again, it's a straightforward, it's kind of a cheat sheet for the person that's taking the temperature of whoever, whatever school it is, whatever office it is. This is their cheat sheet on what do we do. If you pass, if you fail, where do we go from here? And it's designed to be able to be read and understood as easily as possible along with those other charts. So I feel like that's an important piece of before we open for a lot of things, whether that's athletics, whether that's childcare, whether that's school. It's our offices. As we increase the time and the number of people that are coming back, it's important for us to have expectations aligned and thought through. So that's what that information is. And we took some of your questions last time and tried to dig down even further on what is it that we could do to make this as safe as possible and as simple to understand as possible, as best we could. From here, you'll see, and I'll let maybe Miss Vivian speak to some of the plans and some of the adjustments. I think you see there, it's up on the screen, the plans for resuming activities. There are several things that have taken place since we've last met. One of the things that was brought up that we thought was a good idea was to have bands, and so we have 15,000 bands ready to be used. That was fairly easy to get, to be honest. That was one of the easiest things in the world to get over this summer. But as you check in, if you get a band, like you guys suggested, you will know that day that you're good. And so anybody that comes in gets a band, and we already know they've been checked, they haven't skipped, they haven't been around, they're good for that day. And so those are things that have have started to take place, and maybe Ms. Vivian, you can share on some of the other plans. Is that okay? And Mark is on there too. I don't,
Please add Mark if I'm not, oh, sorry.
And Mark, if you have anything to add, please don't hesitate.
Okay.
I say some of the things, we didn't change much on this, plans for resuming activities, but we did add in the check-in procedures, and that's part of the part where Mr. Steiner was talking about the bracelets, the bands that will be used. Every coach has this written in their plan too, to remind them of the check-in procedures in the parking lot. Try to do it before in the car, so that if they did have a fever, that they have not gotten out, they get to stay there, and we tell them to go home and go to the doctor, get checked out if they have any symptoms. And then have the students scan the QR code. We had that done. So we have that with the health screening. So we've got that ready to go. So that's easy for the kiddos. We also have a hard copy for those that do not have technology to use. And then once they've answered all the screening questions, then we will give them the bracelet that indicates that they've met the health guidelines that must be worn during practice. So anytime a coach sees that, they know they cleared the questionnaire and are good to go, okay, unless they start showing symptoms on the field, and then obviously we do other things. The other thing that we changed, guidance for groups of 50. We know that's the next number up was 50. We're in 25 and 50. We were not comfortable with saying one coach with 25 or one coach with 50 people, because one gets it, they all go down. For one thing, you lose a lot of people if one person gets sick. 10's more manageable for a coach, I think, and you knowing your kids and daily knowing if they're healthy or not. And obviously, it only affects 10 people, 11 people actually. So that was added in down there that will continue, obviously, to follow the KHSA guidelines, but will allow maximum of 50 in practice sessions of no more than a 10-to-1 ratio in subgroups. So yes, you could have 50 people show up for football, but he's going to have groups of 5 and going to station. You don't change coaches either. That group just moves to a different station. So a lot of people were concerned about that, and some people are. They're allowing coaches to kind of be more in movement. But right now, we feel that just eliminates a lot of issues right now until we know more. So they just would move from subgroup to subgroup. And if you look in Josh's plan, he has specific places that those subgroups will be on the football field, on the practice football field, around the stadium. Just like all the others that have done as well. Let's see. I think that's really all the changes on this plans for resuming. Is that correct, Mark?
Yeah, I believe that's pretty much it. I will say that that check-in procedure, we modified it so that really we're checking the temperature of kids in the parking lot right when they get out of the car, maybe even before they get out of the car. That way their ride doesn't leave. And if they have a temperature, we can just say, no, I'm sorry, you can't come in and participate at all. And we also decided that we're gonna discourage carpooling and tell them that they should ride with their family members, but they're kids. And if one kid has fever and there are 2 other kids in that car, none of them are coming in to that practice.
Good point.
And then also, I'm sorry.
Good point.
Okay, thank you. Also, with the groups of 50, and our 10-to-1 ratio, that's basically what we had on our plan last time with football. So we aren't changing really the groupings at all from what it was before, even though it may sound like it is, because we're saying groups of 50 now. But football's plan the last time we met had 5 groups with 5 different coaches with up to 10 kids. So, as far as that goes, our numbers haven't increased, even though it may sound like it did.
one thing we probably need to remind everyone is that this is not just an athletic piece. It's an extracurricular piece that encompasses any club that's meeting, any team that's co-curricular, band, in any sport. So it is students as a whole, not just sports. And I know we're talking about sports this evening a lot, but it does encompass some other things. One other key piece that that Ms. Bird has worked with us on and has in your packet is the acknowledgement of risk waiver. And that was something that I think that one of you brought up last time as well, that there should be something that parents can sign and students can sign saying they understand some of the risks that are involved with this. And I think that's well, she's a lawyer, and so that's a well-written risk and waiver. So it would have, if Will or Daniel were still playing, or Ellie, I would have to think about it before I signed it. That is in there. It's there. We understand and we hear and we acknowledge that it is a tough spot to be in, that there are many situations going on and things we can't control. And we hear and we read often of groups that are trying to come back and they're having issues, and that worries us and it concerns us. But at the same time, we feel like part of our purpose is to give you what we can that we feel best protects the students that we have. And knowing the risk, knowing the situation, won't make anything any easier, but it's just the awareness of where we're at and trying to give you the most information to help you make a wise decision. That's all we're here to do. So you can also see the plans that are listed, and some of those have been tweaked and updated, and just to kind of see where we're at. But I'll entertain any questions. But I think we have Mr. Horton on here as well. So whatever questions you have, we'll try our best to answer them.
Mr. Clay, is there anything that you'd like to add to what's already been presented?
I don't have a lot to add other than, we've been in communication with the staff at the school system for a number of weeks, maybe months. And we've looked at their plans in various states of draft, and they're well thought out, well put together, and they have our support at the health department.
Thank you so much. I know you all have worked tirelessly in our community, and we appreciate you carving out a piece of time to help get our folks and our kids back safe. And it's been an ever-changing, but we sure appreciate everything that you've done. Mr. Steve, is there, and there's someplace in all that, there's a lot of documents in here.
Okay.
Is there a date in here, a calendar in here about testing?
Well, yeah.
There it is. Mr. Horton, have you seen this rough draft about the COVID testing for the different sports?
I've exchanged some emails. So, I think we've had some conversations about maybe doing testing in phases. And we've even looked at like the first phase. From the health department perspective, there's a couple of different, objectives that are going on. First of all, we are encouraging folks to get tested for COVID-19. We have this federal benchmark that we're trying to meet as a state, where we're testing 2% of our population a month. And so when you're kind of driving from that objective, it's hard for me sitting at the health department to discourage anyone from ever getting tested anytime. But with that said, I think that as we work forward on testing plans, there has to be an understanding of what that test result means and what level of safety and reassurance that it gives you. It gives you some level of reassurance that on that day, that individual is negative and they don't pose any type of significant risk. I think the plans that you all have put into place involving the screening and the physical distancing and requiring masks to be worn when practical, or when you have to interact for like team meetings, and checking in, those type of things. I think those are all good, solid practices. We have talked with staff about being willing to help support some of these testing efforts. All of that is, contingent upon kind of moving forward, assuming that I will be able to get the lab resources in place to support that. The first phases that we've talked about, we have been able to get those supplies, and I think that we can work with you on that. It's just a matter of looking at the schedules and working out some of those details and the logistics. There's the devil's always in the details, as they say, and so just logistically looking at scheduling the number of nurses that we have available at the health department. I think we can work it all out. It may not match that schedule exactly, depending on how we can get athletes scheduled, how we can get them, get information for registration. There is a piece that it may not be an issue. You all may be used to dealing with this. We'll have to have parental consent for, I'm guessing, most of the athletes, because most of them are going to be minors. But we can work with you and try to work around that schedule to the best of our ability.
Thank you, sir.
From a health department standpoint and guidelines that you're looking at, what level of new cases per day is supposed to be when this thing is in control or considered in control? I mean, we're in a pandemic.
I think we're looking at more than just cases per day. And right now in Kentucky, and I would say even here locally, our number of cases per day are relatively high. We saw a steady decline for about 5 weeks. We had an uptick last week. It appears that uptick is kind of continuing this week. We're looking at some other things as well. Our positivity rate, the number of tests that are taken, and what percentage of those are positive. We're trending as a state around 5%, which is in a healthy range. If that goes higher, that would be of concern. We're looking at healthcare resources. There's a number of metrics that are being looked at kind of on a bigger scale from the state. I think right now our biggest challenge, we are seeing a steady number of cases being reported. They're not coming from one major source or sector, which we experienced back early in the spring. It just is kind of general spread. We're seeing a number of small clusters. We're seeing cases associated with travel. We're seeing asymptomatic cases. Healthcare providers are now required to test patients before procedures. So if you're going in for a colonoscopy or going in for a knee replacement, they test you for COVID, and some of those individuals aren't showing symptoms, and they come back positive. So, we're just kind of seeing it across the board. So, I don't know that in the near term we're ever going to get to a place where we say, oh, we're comfortable, it's all under control. I think we're always going to kind of have to be on a defensive stance, trying to push that messaging with folks about why it's important to cover your face if you're having to interact with people in public, while you're trying to create that physical distance, but and how we have to do things differently than we've done them before. Again, in at least the short term. So that's why you're putting plans into place to screen folks before they're into activities. It's really all about doing everything that you can do to prevent the spread of infection with your population, and then being able to manage that and control it and identify contacts and kind of respond to it when you do have cases, because I think we will. And I don't think, I think that that's just the reality that we're working in, for the next year or so at a minimum.
So from the standpoint of looking at athletics and anything, even opening the schools, we're accepting the fact that we're going to get some cases.
Yeah, I think so.
Okay. And so at what point do we feel that it would be, that it's time to either cease activities, or instead of just 10 affected kids in this pod, do we say, hey, this is stopped, or because, I'm thinking that when we closed schools on March 13th, and between March 13th and the last time we met, Henderson had 81 or 121 cases. In the last 20 days, we've had 34 cases. So, when you say uptick, no, we're increasing. We're showing a lot more cases in 20 days than we did that first 84 days from when we closed schools to when we had this meeting on what was June 5th. And 20 days later, we're averaging almost 2 per day. And I mean, I was of the opinion, or thought I was of the opinion, that there was so many cases per million of population that you might be under control, or I mean, and I don't mean acceptable or anything like that, that, we're going to see in this situation where you have some level of control. But in these last 20 days, there's been a showing in just the last 2 days also. 30 states in the United States are showing anywhere from 10 to 120% increase in new cases that are not attributable to just testing. Do you agree with that, or am I way off base?
I agree with that. I think that it's attributed to, we've increased our social interactions with each other.
Absolutely. So now we're talking about increasing social interaction with athletes, right? Or extracurricular programs, band, cheerleading, and so forth. And again, at the last meeting, we had 2 million in this country. Now we got 2.4 million that have been affected. We had 110,000. Now we got 123,000 that have died. Athletics is not a priority when we begin looking at this. I know athletics is part of our education process. I don't disagree. The plans that we have in place are great. But when we put these coaches together with these kids, the coaches want to coach. Mark, Vivian, I know that you're really pushing these folks to control this. Who controls the kids when they leave? We're relying on the parents, correct? And Clay, what are you seeing out here? I mean, you're seeing people that don't want to wear masks, right? They're not wearing masks.
We are seeing that. One thing to your point that I would say and offer is, we've learned a lot since March, and we haven't learned everything yet. But you've probably read about this in the news, but the meat processing industry were big hotspots for us locally. What I would say is that we learned a lot from that exercise or from that experience, in that, that's a sector that I'm not going to say they didn't take it seriously, but perhaps they underestimated the virus and how easily it could spread. That's why we saw these rapid accelerations in cases. And that was especially at a time when everything else was shut down, or most everything else was shut down. But we did see that when they altered their processes, when they did an effective job at screening folks starting work, when they were using universal masking in the workplace, when they were conscious about making sure that there wasn't close and prolonged contact in common areas, when they put some mitigating factors into place with carpoolers, people riding together, we saw those cases drop way down. So, to your point, there's never going to be zero risk. And I don't think my position here at the health department is to argue for or against athletics, but just to say that there are strategies that we are seeing that are effective in controlling the spread. We're never going to have zero, in this environment, but we're probably a lot better prepared, kind of coming into now, to deal with this than we were in March. I don't think in March any of us knew what we were doing.
Well, again, in the last 20 days, though, is what I'm talking about in Henderson County. The last 20 days, we're showing somewhere in the neighborhood of an average of 1.7 per day. And if you begin looking at millions, that's about 38, 39 cases per million. And prior to that, we were at around 30. But even the United States yesterday, 45,500, the highest one-day total since this thing's begun. But I'm not asking you to say, is it right for athletics? I'm looking at our group, because we're the ones responsible for these youngsters. I think we have a good plan, and I've said that from the very beginning. But at what point do we decide maybe it's not worth the risk?
I think from my perspective, I think we're going to have to try it and see. And if it gets to the point that we have to shut it down, we have to shut it down.
I don't disagree. I want these kids back out there. And
I
I think there's some ways of doing it. But, if it were left up to me as an individual, just me, right now. But I'm going to tell you right now, okay, I'm going to support what our superintendent and board chair offers as a recommendation. I will support that, and I'm going to support that. But if it was left up to me right now, all the high-touch indoor and outdoor fall sports would be canceled right now. If it were left up to me as an individual, not politically right for a lot of folks. It won't be real popular. All the high-touch stuff would be canceled, indoor, outdoor. And the only thing that we would open up right now would be the low-touch outdoor sports. What are we talking, golf and a few other things like that, and the low-touch indoor with no spectators at all. The only people allowed would be the essential people, and then operating within the guidelines that we presented. That would be the only thing I'd be willing to open up right now if it was left up to me as an individual, but it's not. And I want everyone to be clear, the most important thing we're dealing with. I mean, the governor came out with this business that says, okay, we want kids to be involved. We're going to say they can go outside and they can play and all that. We're talking about some stuff the KHSAA put together that said, oh, yeah, now the governor said kids can go outside and play. Now we're going to say, okay, let's open up all athletics. You don't have to look far across this country. All you've got to do is look 100 miles south into every state in the South, and they're having problems. Texas and in places, they shut it all down. Places in Alabama, all the colleges, they're having kids. We've got to be cognizant of this, and I want the kids out there. I really do, and I'm not going to say anything other than if we're going to do this, we set a specific date sometime after 4th of July, that if we can go outside and do everything outside, I'm talking about everything, we have less likelihood of kids being inside and that kind of stuff being passed through the air conditioners and that kind of whatever may be non-filtered or I don't know. But we're taking a big chance right here, big chance. And the health and safety of these youngsters is paramount. And to think that this business has gone away, I mean, we're all sick and tired of this corona. We are. But it ain't tired of getting us sick. I mean, it's still getting people sick every day. And we're talking about let's put some athletes in. If we had put these athletes together a couple of weeks ago, we would have been in a real problem because some youngsters were infected, as we well know, because they're not observing the health department's rules or what we think is the right thing to do with masks, social distancing, not a lot of large crowds, and it's increasing across the whole United States right now because everybody thinks it's gone away. It's not gone away. So, again, my two thoughts. The only thing that I would change is that we would, everything that could be done outside, be done outside. And I'll support the recommendation of the superintendent and the board chair. But if it were left up to me as an individual, I want to be on record to say everything that was high touch, as is defined by the KHSAA, indoor, outdoor, be canceled for the fall right now. The low touch would be the only thing that we would go with, and the low touch indoor stuff would only be conducted with those essential people with no spectators. Thank you.
Thank you, Mike. Ms. Tracy, you got comment to this?
I think the plans that our team has, the team that we have, has worked enormous amount of hours to put this together. I think we're going to have to try this. And I mean, I'm a parent. I would be scared to death, but I would have to at least make sure that my kids were doing what they were supposed to do. We have coaches that know what those kids need to do. And as long as in these sporting practices that we're trying to decide what to do about tonight, that as long as kids are doing as they are told by the coaches who have been trained, then we're going to have to at least try it. And we know that if we see, increases in numbers in whatever sport, we have the ability to call a meeting that day and say, that's it, we're stopping right now, we're stopping today, because we have numbers that are increasing. And like Mike said, it's not gone away, it's out there, we know it's out there. But another thing I think we have to do is we're going to have to put the trust in our parents to take care of their kids and make them do, the things that are going to keep them safe. And we know as parents, that's not always an easy thing to do. The kids want to get together. They want to be around one another. But if they're practicing and they're doing football or volleyball or whatever, cheer, dance, whatever parents have to do to keep those kids safe, that's what they need to do. That's what we're going to do. We're going to put everything out there that we can do to keep those kids safe and allow them to step into gently these practices. So we've got to ask parents to do the same thing. We're trying to do as much as we can do. So parents, you all need to step up and meet us and do what's going to keep them safe, not what's the easiest thing to do.
That's an excellent comment, Tracy, and I can appreciate that. And all you have to do is look out the window and see how much responsibility is going on out there, because we've got people walking around with no mask. They're not observing social distancing, and there's kids, parents, and babies out there. So that's a heck of an expectation.
Oh, it is.
But I will support your recommendation and your recommendation.
Mr. West?
May I,
I'm sorry, go ahead.
may I interject just for a second? I agree with what you guys are saying. We're planning on me making a video when I get back from vacation next week, kind of outlining the family expectations and the athlete expectations, along with the coaches' expectations, so that everybody knows kind of that we're all on the same page and what we want from them. And I am out of town right now, and one thing that I've noticed is people seem to be wearing their masks here a lot more than what I saw before I left town. And I think that in Henderson right now, it has become sort of it's not hitting us too bad, and my family isn't getting it, and who cares? And I think that's kind of a bad way to think. But what I want to do and make sure that the coaches know is that we're expecting these kids to follow these rules because it's safe. And hopefully that will make a difference in the way that they feel and the way that maybe they even interact with their own friends, and whether they wear a mask, out in general public or not. Because like I said, I didn't see many masks in Henderson, I feel like, at all compared to what I've seen on vacation. So maybe, I know it won't make a huge difference, but it might make a little difference in getting more people to follow the guidelines a little bit more closely.
I appreciate your idea about the video, and I think that's good. So it needs to be said that if you're going to participate, and this is an extracurricular thing, you don't have to be in football. You don't have to be in any of these sports. These are extra things. These are gratitude. These are gracious things we're letting you do. So you need to be responsible and carry your end of it. The schools tried our best. They need to try their best too. But I love the idea of the video. Thank you so much. Can I go down to Mr. West?
I'm all for opening up the sports as recommended, and I think we'll find when we open this back up and we give these guidelines out, I think you'll find more people getting accustomed to and following social distancing, wearing the mask. Because if I'm an athlete, I want to do whatever I need to do in order to play my sport. You got to think they're going to do the same, or at least I would hope. So I appreciate all the work you guys have done on this. I think it's a great plan, and I look forward to opening back up.
Mr. Kirk?
I got lots.
Can we make it short, because we spent a ton of time on this and we still have one
Yep.
more item to go.
I
So-
would like to ask Mr. Horton a couple of questions while he's with us, and so the community can hear. So community education. Mr. Horton, please explain how contact tracing works, and then please explain about we have one hospital here, and how bed occupancy and capacity works with the guidelines that were given.
Okay. So I'll start with contact tracing, which is something that you've heard in the news a lot. And contact tracing is is simply the process that we use, and it's not something that's unique to COVID-19. It's something that we do regularly on a much smaller scale, primarily with other infectious diseases like tuberculosis, foodborne illness, gastrointestinal diseases, STDs, so on and so forth. But it's basically just an interview process. So we have a reported case. Laboratories, healthcare providers are required to report those to the health department. We very quickly follow up with that individual, and we get some information about where they've been, who they've been in contact with, what they're experiencing, what are their healthcare needs, and we just provide guidance. And we follow back from there based on the information that we gather from those individuals. And then we start getting into contact with the people they've been in contact with. We do a risk assessment. We provide instructions. So it's, for the most part, in this scenario, it's a phone call and providing some instructions. We typically follow up with some written instructions. And then we stay in touch with those individuals every day until they can be released from isolation or quarantine. So it's not some sophisticated big government program. It's just kind of good old-fashioned fundamental public health work, getting information and providing education. So on your question about hospital capacity, that is something that is monitored at a state level from the state health department with all of our hospitals in the state on a normal basis. They have a system where hospitals report their occupancy level or their census and their availability of additional resources and beds. So with the reopening guidelines that the state has put out, there is a mandate that hospitals maintain at least a 30% vacancy or capacity, both in normal beds or regular beds and ICU beds. And that's so that there is some level of surge capacity if we see an increase in hospitalizations from COVID-19. So I think that normally is done through a process called have bed or have a bed. It's an electronic reporting system. I think there may be a couple of other redundant reporting systems that are in play right now because of COVID-19, because the state's off of collecting information on hospitalizations and how many COVID patients are in ICU units. So that is monitored regularly from the state health department perspective.
Okay, thank you. Because we have to remember that we could have any number of natural disasters, like the earthquake in California a couple days ago. So the bed capacity and the capacity of our healthcare providers who live and work in our community is one of my gold standards for opening and closing. I count it from up until June 23rd. We've only had 29 reported cases in Henderson. So I've had a lot of people say, what data are we using? And so that's why I asked Mr. Horton about the bed capacity and looking at Henderson County numbers. For all of you all out there watching on YouTube, I'm talking to y'all. Because our core values are excellence in all we do. So I'd say let's go for it. Let's have some sports and activities. But we're relying on you to be excellent, Henderson County Colonels, that we are cultivating a community where our character, your character matters. And I want to be riding around watching you all practice, but I want to see you practicing the guidelines that we've put in place for sports and activities. I want you to be the change agent. This is the time for Henderson County students, educators, and our community to come together and not be divided. So I am ready for us to, let's give it 3 weeks, and at our July 20th regular board meeting, we can come back and revisit the whole discussion again. Let's see what happens.
Thank you, Mr. Kirk. Well thought out. I appreciate that. I like your tying it in, yes. Yes, community, you all play a role in this, and you all play a responsibility in this. So, Mr. Steiner, do I understand that we are going to be expecting students to be tested and has a negative test before they come, or is that not included?
That's a consideration we wanted to present to the board and asked your opinions on that. One of the things that we came up with in our meeting, and Ms. Stanley can speak to it as well, is when should that test occur, and how many days before? If we just say, hey, you got to have a test that's positive, or excuse me, no.
A negative test.
If you got to have a negative
Negative test.
test prior to beginning, I apologize.
That's okay.
Then it really needs to be within 7 days of when we start, because that seems to give us the best answer. It doesn't give us, like Mr. Horton has said, and he has truly been with us over the last several months and worked with us on several things, but we appreciate that. But you test and you know then I think what kicks in is our screenings, the best that we can do, that we have listed. So
okay.
we like the idea of having students test. We understand there's an obligation payment-wise, but then there are also groups that said, hey, if you'll, Mr. Horton's group is going to help us with testing if that's what you deem appropriate. But then there are other groups that will test with us and have offered to do physicals and the test at the same time, and maybe even give us a $5 back to the donation of this athletic department, which we would say it's extracurricular departments. But
Right.
Ms. Baird, I'd like to say that the piece about testing the students, though, actually was a request from you all for us to research. When we presented the original plans, we presented just plans and not really testing. And so we felt like tonight that we needed to make sure we collaborated with Mr. Horton to see if that's even possible, because we have a large county and a large number of athletes. So that's why you saw in the bylaws that Mr. Steiner shared with you the piece about testing, and then he had question marks by it. Right. We really are searching suggestion from you all as to whether or not you all feel that we need to do that based on the guidance that he shared with us. So we're not sure how to recommend that portion without some guidance from you all.
My response to this, and I've listened to everyone else here, and Mr. Horton is right. We can only do everything right, and if it comes down to where everything we have done right is still not working, then we may have to stop it, but I think we need to try. And so my request would be that every student athlete be tested and have a negative test before practice begins, which I think we're talking the 13th would be the first week. So then they've got a whole week. Now, if the parents can get a test done someplace else and come back with a negative result, and that's on a good formal paper that we will accept, that's fine. Any extra, then maybe Mr. Horton and his group and any other outside groups could help. But I don't think that we would have to have our local health department test every student if we had someone else that could get a test someplace else. But it needs to be included with the physical that they have to get every year. And we have seen colleges that, yes, had every kid tested, but they didn't wait for the results to come back. They started practice immediately. Test results came back, and they had 4 or 5 of them positive, and they had to shut the whole thing down. So what's the point of having the test if you don't get the negative results before you step on the field? And then after we get that negative test, if we do all the steps that Mr. Steiner and his group have put together, we have done our due diligence and tried our best to keep everyone safe day to day. But I think that needs to be included in our physical, that they need to have a negative COVID test before they step on our campus.
Regarding the date, you said July 13th.
Wasn't that what we were?
I
Well, if
haven't
we were
heard a
talking about
recommendation
testing,
of a date yet.
I don't think we've come up with a date yet.
To me, the date is quite a bit determined by the testing, to be honest,
You have to have-
because
Yes.
it will take, if you can see with the plan, it would take 7 days for us to be able to test the number of athletes at 135 to 140 a day to have our kids all tested, ready to return. And so,
With results.
right, with results. And as Mr. Horton shared, the kids have to have registrations filled out. We have to get parent consents to do that. We would need to, which we can get all that done, and we would need some staff to help organize some of that. That's a lot of testing in one day. So right now we are on the 25th. Is that the right day? If we started testing next Thursday, the 2nd, and tested the 2nd and the 3rd, and then next week, that following week, the 6th, the 7th, the 8th, the 9th, and the 10th, we would have our 7 days in we need to for everybody to be able to start on the 13th. So that kind of hinges on a recommendation for a day to start, really depends on the testing, to be honest.
Okay, I have a question.
Sure.
I'm trying to think how. Are we saying that we are physically going to test them, or like if, let's just say Zach was playing football and tomorrow I went to one of these sites and I got him tested and he came back negative. So we're not saying that we are going to be responsible. I mean, like Ms. Baird said, parents can take their kids to a testing site, and so it's not, I mean, we
They
can make
can.
it available for kids that can't get tested anywhere else, like they could go to the health department or some of these other entities that are saying they'll do it. But we're not saying, or I guess I'm asking
No,
you,
I'm not saying that they
Okay.
have to get tested
just
with the
us.
site that we set up.
Okay.
But we have over 800 athletes to test.
Mhm.
And so we should do our due diligence to set up testing sites for our students and opportunities. And they can only literally physically have enough time to test this many kids a day. So that's why we structured it into 7 days.
Now, is the
And
turnaround?
Clay, you can weigh in on that however
is the
you want.
turnaround
Yeah.
24 hours, Clay? What is your turnaround for testing now?
Yeah, typically 24 to 48 hours is what we're seeing getting results. I mean, if you throw a weekend in there, like we test on a Friday or something, it may be a little bit over that. Some of the labs aren't running on Sunday. So I think what I would suggest to the school system and to the board, and especially if you're looking for us to help with a big part of the testing, that there may be some flexibility in your schedule. I mean, kind of looking at like time frames, but I know that just logistically, we would be able to do some testing next week if we get some, the consents and things lined up. I'm not going to be able to have folks work on the 3rd because that's a state holiday, and I've been pushing my folks really, really hard. I'm probably not going to be able to take that away from them.
Don't blame you, they deserve it.
We'd be looking for you somewhere in the bottoms.
Yeah. So I mean, we are working over the holiday, but it's going to be kind of a limited crew. But yeah. So I mean, I would hope that if you all make some kind of approval that the time frame would be somewhat tentative, so that we could work out those logistics and get kids scheduled, and make sure that we do it right, we're not rushed, and we don't miss anything. But I will say this: I'm sure we can get it done. It's just I worry about if we have a real tight time frame that we don't have any flexibility on.
Okay, so we as a board just need to offer the direction that we want every child that's going to participate in any of the programs that are going to begin at whatever time you decide you're going to begin them, whatever date, or what, must have a negative COVID-19 test along with their normal physical, and that we will within 7 days of whatever the start is. So here again, I'm going to say that I'll support the recommendation of the superintendent and our board chair as to what we're going to do with regards to athletics, as long as it contains something that says that we're going to, and Vivian, if I'm not mistaken, the KHSAA said highly recommends everything done outside. Highly recommends.
So
And I would say that if highly was all capitalized and italicized and whatever in that, it means do it outside. Right? Thank you.
So to give Mr. Horton and any other medical facilities that parents can use time to get these tests done and the 7-day period that we are looking at, correct, Ms. Stanley, that they would need to be starting testing next week, and the earliest start date that we would have for any of the athletic or other group events listed here for fall sports, the earliest start date would be July the 13th. Am I understanding that correctly? That gives us time to get everyone tested? Or are you saying 7 days
I'm
for the
looking
test?
for,
I would say we would look at the 13th for a start time.
Right.
But we would need to work with Mr. Horton to back up the 7 days, because here's the thing, if we know that we can get all the testing finished and ready by Monday the 13th for kids to go, kids and coaches.
Right.
Coaches have to have testing, I would assume too, not just the
Yes.
kids.
Yes, not just, yes,
Coaches too,
everybody.
yes,
Yes.
that's what you're thinking.
Don't forget your microphone, Ms. Stanley.
Then, oh, sorry.
Sorry, I want everybody to hear what you're saying.
Then we wouldn't want a student to go tomorrow and get tested and then get ready to come for the 13th. We would need to work with, as Mark Andrews said, put that in our training video that Megan and him are going to work on Monday to explain the time frame to get that testing, if that makes sense.
Okay.
Because we wouldn't, if they hear tonight that we're going to start the 13th, I mean, you don't want them to get tested tomorrow. That's 14 days from start date.
No.
So,
So
if you can't get the test arranged and whatever, then it's 7 days from when we start them. If you start them on
it's 7 days from
July
your
the
test.
8th, then it's the 15th, the best you can. And everybody has to have a test. If they're going to participate, they must have a negative test. And need to make that clear to these folks.
Okay.
If that's what's your recommendation going to be. I'm going
So-
to support your recommendation.
So listen.
Madam Chair, I have
Yeah.
a motion.
Okay.
I move that summer activities begin Monday, June 29th through the close of business on Monday, July 20th, which is our next regular board meeting. That coaches follow, doesn't say anything about having a test before we start, that we follow and trust the administration and the coaches to follow this chart. We're asking people to sign the waiver. That gives us 15 days to see what happens and to see if our students and coaches will step up and be excellent in what they do.
So you're saying no test?
No test. The district will follow we guide the administration to follow the chart that's been designed, the waiver that's in the board packet, the guidelines that have been presented, and that at our next board meeting that we have a progress report. How many people are participating, Ms. Stanley? Like, how many people actually said they had 2 symptoms? How many people actually did go and get a test on their own, like at our next work session? But
Okay.
let's give them 3 weeks. Let's see what happens in 3 weeks.
Okay, that's a motion on the table. Do I hear a second?
I'd second it.
Okay. All in favor of those two motions, say aye. Any opposed? No.
I'm opposed.
Tracy?
I'm opposed.
Sorry, guys, failed. Okay. Mine's going to be a little stricter. Sorry, Kurt. My motion is that athletics and fall activities begin no sooner than July 13th with a negative COVID test from an approved site be included with their physical, and the test must have been done 7 days prior to beginning that activity.
Was that a motion?
Yes, ma'am.
Sorry, I was writing. I second that motion.
Okay. All in favor say aye. Aye.
Aye.
All opposed?
No,
No.
Okay. Sorry, guys. That motion's carried.
that's 800 tests to be done.
Yes, it is. The motion's
And
carried. Thank you.
They're going to work through it. We're
Athletics
gonna-
is
Thank you were the
done.
chair, Mr. Waller. I thought Ms. Baird's the chair tonight.
I'm sorry.
I thought you were the chair tonight.
Was? Yeah, thank you. We have to do the best by our kids. The other option is not doing sports at all, so we're meeting them in the middle. We're trying to get to excellence, and we're trying to keep every kid safe. I have to remind everyone, as a young person told me this week, that after all the school shootings started, and after Sandy Hook, if we had done nothing, if we had not hired any additional SROs, if we had not had classrooms closed, if we had not done all the safety things in place, our community and our parents would have called us irresponsible. This is an intruder in our schools and on our fields as well. This intruder is just invisible. We as a school and school board have to put the safety measures in place, just as though Sandy Hook happened yesterday. And that's where I'm coming from. So, okay, moving on to requests regarding upcoming work sessions. Ms. Morgana?
Sure. I want to take just a minute. I made a few notes here I'd like to share with you all. First, I want to take the opportunity to thank you all again as board members for diligently listening, patiently listening, and honoring the work of the task force committees that reported to you at a board meeting. They started back in May. Teachers and staff worked together in May to assess where our students were instructionally, identified gaps through the 30 NTI days that we worked through. And the instructional team also communicated among teachers what the next grade level teachers would need to really focus on and cover when we do return to school. They made a plan for reopening. And there were several options that were discussed about how we reopen instructionally in that task force. None, of course, have been suggested to you all. We've not even got to the how part that we would reopen. Logistically, we've really looked deeply into how to bring our students and staff together in a variety of ways. That team looked at using NTI, which throughout this next school year could be a possibility. We hope we don't have to start that way by any means, but we may have to still use it throughout the 2021 school year. And we even came up with some really out-of-the-box thinking of what if we could only put our kids together 1 day a week or 2 days a week. And so that group has lots of plans just kind of sitting here in place just in case. And, of course, our personnel committee work, too. Thank you very much tonight for embracing the virtual learning option for our kids and parents. That, I think, is exciting, and it's a great opportunity for our students and families. I just give that little reminder and background because it's a simple request of memo that we put in there about thinking about work sessions in July. We decided tonight when to start school, so we have a calendar in place. We've decided now to look at childcare. We're going to work through the athletic piece. Now I think we're ready to focus on maybe a little bigger piece. Yesterday, the governor and the commissioner of education spoke and released a guidance document that I'll give you a copy of tonight. I'm sure you listened to the governor and you probably already have a copy of the document. We welcome this guidance. When I say we, our instructional group, our central office team and principals, and the other superintendents around us that I talk with and across the state have welcomed some guidance. In your board packet, I say this because in your board packet, I requested for the board to consider a work session on July 13th. But because we have task force committees in place that have already spent 5 to 6 weeks brainstorming ways and ideas instructionally and how to return, and we just got new guidance yesterday, I would actually ask if you all would consider looking at your calendars and moving that July 13th date maybe up to the 8th or the 9th. I believe that we could, you can determine that night whether or not you want to take the action on how to reopen, or if you want us in the work session to present options similar to what we did in doing reports. I just feel like that there's been a lot of work already done, and that we would be ready to start to present information a week earlier, now that the governor has given us some more specifics to really look at. So our request, even though the memo says July 13th, we will take July 13th, but we certainly would see if the 8th or the 9th would work for the board. And then I also put in there some KSBA training, because as you all know, Dr. Bob Lawson has joined us this evening too, and I think that's another decision to make. Thank you.
Okay. Board members, look at your calendars. What are, if you look like for the 8th or the 9th or the 13th? I know personally myself, the 8th, I would not be available. I'm not sure about the 9th. The 13th, I definitely would be able to, but that's neither here nor there, because we have 4 other board members who's more than capable of handling this, so.
Well, I think at the last meeting I'd shared I'm actually out of town that week for work.
You're out
So
of
I'll be available on the 13th, but that week I'll be out.
I can assure you we are happy with the 13th, but I wanted to give you all that option. We just, originally when our team, the district team, thought about how to make the decisions of how to reopen, let's go the 13th and then the regular meeting the 20th. Now, yesterday, the governor and the commissioner handed us some new good guidance. And so, but we're fine. We'll take the 13th.
13th would be good, and maybe by that time, Ms. Casey will have more information on some of her details and have some more of the stuff that you could come back to us, because that's also going to be part of our opening, some details about how we're going to be counting students and then what the extras are for. So is the 13th okay? Mr. West, can you do 5:30?
Yes, please.
Mr. Kirk? Yes. Ms. Tracy? Yes. Mr. Mike? July 13th at 5:30 it is. Okay, fall training date with KSBA. I just need to be able to give KSBA a couple of options of dates. Either August or September. I vote September. You vote September? September looks good for me. Wes, is there a particular week that you're here, not here in September? Am I going too far out?
Yeah. I mean, my calendar's open right now. So
Calendar's open right now. Okay. Mr. Kirk, you'd be going back to school. What's your options?
Dr. Lawson, do you have a preference for day of the week or anything like that? Okay.
I have a question.
Yes, ma'am.
How long were you thinking, like time? Are you talking about a 2-hour training, a 1-hour training?
Hour and a half to 2. I don't have specifics exactly from KSB. I'm going to guess at least an hour and a half.
Okay. Well,
It's a training session they already have set up, but I didn't get the details of that part.
I was just thinking if we're all meeting on the 21st, and with Kirk having the travel thing, then if we could do it on the 21st, like at 4. I'm sorry, September. It's the same day as the board meeting, Morgana.
September 21st.
Oh, yeah. Okay. That's okay. I was just thinking if we could do it on the same day, and that was just me trying to.
Or not to do it.
Okay, you would prefer not to do it that
I'm
day?
just thinking like worst case scenario, like we still are doing all this COVID discussion.
Okay.
And then obligated ourselves to another hour and a half.
Okay, I was just trying.
Like I like you all, but my brain is tired right now.
Well,
so, but if Dr. Lawson had a day of the week, it doesn't have to be a Monday for me.
okay.
So, or if Wes had a day.
Are Wednesdays or Thursdays? Wednesdays or Thursdays better? We could do a Thursday, possibly. Okay, so. Okay. And like I said, I'll have to go back to KSBA. So Can I give them the date of possibly the 10th, which is a Thursday, the 16th, which is a Wednesday, or the 22nd, which is a Tuesday? Can I give them those options and then let them come back to me?
Yep.
Those are a couple of different days and a couple of different dates. Is that okay? Okay. I will check with Laura, and I will get back to you on that. Thank you, ma'am. Okay. I think that has got everything. Mr. Steiner, Mr. Steve, are there any other actions to get your athletics and fall sports moving forward that you, do we understand and you understand what we're asking for?
Yes, ma'am, and
Okay.
and I can assure you it is not mine.
Oh.
It is ours, because there's a whole lot of people that have been working with this.
And I appreciate
for,
everything they've done.
That's huge, but I think between Ms. Stanley's notes and my notes and probably Mark's and Vivian's, we'll have everything that
Right.
we need to have
Right.
squared
Right.
away.
And Miss Bird's,
But we
and Miss Bird's
appreciate,
legal injection as well.
yeah, we appreciate the fact of the seriousness that you all take it and the efforts that you all put into reading what we have and then also sharing the other information, because it is a scary spot. It is a tense spot, and it is something that we will definitely hold in high regard on our expectations, and we will emphasize to our coaches. If your kids want to play, like Mr. Smith said, if your kids want to play, they're going to want to need to do what we ask them when they're not with
Right.
us. And coaches have an influence there, and parents do as well. So I appreciate all your comments
That's fine.
and concerns.
I just want to make sure we had
Yes,
gotten
ma'am.
everything, all your checklist off so that we all understood what was being done. So
Yes, ma'am.
just wanted to do that before we left this evening.
And
Okay.
Ms. Beard, just kind of
Yes,
one
ma'am.
comment along that. Part of that waiver and consent, when I was putting that together, I went through waivers from all across the country, colleges, high schools, and looked at all the different things that were included in those. One of the things each student and parent is signing off on is an acknowledgement that a student athlete has responsibility not only for themselves, but for others. And that a condition of participation is compliance with all the expectations and guidelines. And non-compliance can be grounds for removal from a team. So it's incorporated in what every single student athlete and parent will sign off on to make it perfectly clear that it's understood that we can tell them, but we can also hold them to it. Right.
Right.
It's another piece that it mirrors the other policies that we already have in place. We already have our policies in place, and that's just another piece of it. And thank you for clarifying that, Ms. Bird. I appreciate that.
The only other thing, and I voted for having that testing, and the main reason is because there are people out there that are positive, and they have absolutely no idea. Now, is Chad going to come to football practice? Yes, he is. Chad doesn't feel bad. Chad feels fine. Hey, I'm going to football practice. 2 days later, he starts getting a headache, starts getting a fever. He didn't come to football practice saying in his head, I know I've probably got the COVID, but I'm not going to tell anybody. He absolutely did not know it. He did not know it. His parents did not know it. So, in order to make sure that at least when they begin, we know that they are negative, period. That's why I think that's a good thing. And the testing is a good thing because of the fact that we have these asymptomatic people that can give it to every single administrator and sitting out there. Didn't mean to. So I felt very strongly for that. I think parents are gonna be fine with it. And they'll probably even take their kids, their athletes, and get them tested so that they can get them in there. So, that's all.
Thank you, Ms. Tracy. Ms. Tracy? I was going to say, I'm going to give you the option to motion to adjourn, and Mr. Mike the second. All in favor say aye.
Aye.
Any opposed? Motion carried. Meeting adjourned. Thank you all.